So yeah, it's been a huge challenge for us because many of the inequalities, those underlying inequalities that COVID is exposing, we've experienced in Bristol. But if I just share a bit about how I see this crisis, and that kind of feeds into why I think it should be led locally. First of all, the challenge of political leadership at this time is that COVID is not landing equally across people. It's landing disproportionately on the shoulders of poor people. And in the UK, well-known people from Black and minority ethnic backgrounds. The complexity around that is that the measures being taken to manage the virus that is landing unequally in our communities are also disproportionately impacting the poorest communities. The furloughing, the redundancies that are going to come, the lack of access to food and social isolation, these are disproportionately impact poorest people, so we're hurting ourselves twice over. And then the wicked challenge behind that is that the measures we're taking to control the virus is not getting rid of the virus. So you kind of, it takes the wisdom of Solomon to navigate a way through this. I think city leadership needed on this front is something I've believed in from the very beginning. I'm part of the Global Parliament of Mayors, and part of our argument is that the kind of challenges the world faces today, the national governments are just not equipped to cope with them. They don't have the dynamism, the flexibility, the ability to work with the interdependence of populations as they move around the world. They play a zero-sum politics, and that is not that doesn't allow the structures and the space for the kind of innovation and dynamism the world needs on everything from migration to climate change, to inequality, democratic legitimacy, and now global pandemics. But there's a couple of other reflections I'll share with you. In this country, even today in the daily update, the question was asked about should there be a more regional approach to managing COVID, because the reinfection rates are different in different parts of the country, which means that the risks of unlocking our country vary. Government just said no. But here's my concern, is that I just think they fundamentally misunderstood what this is. COVID is not simply a national health service, a health system crisis. It is a social issue because it's a public health issue. Public health is not delivered by health services offering specialist interventions such as operations and intensive care. Public health is delivered through good quality housing, good quality education, supporting parents, good social connectivity. And that is delivered at the local level. National government cannot issue edicts from London, Whitehall, Westminster, and get those outcomes at the level of place. It's about personal behaviours and personal connectivity. And that happens at the level of place where people actually live. All-encompassing statements from London do not deliver that. Secondly, but our Prime Minister has said recently that the approaches to unlocking need to become increasingly complex. And that's been one of the things that's caused confusion in our country. So here's my little provocation on that. You cannot do complexity from one-dimensional statements from Whitehall. Complexity, and I would prefer to call it nuance, can happen at the local level where political leaders know their population and can respond to the micro needs of specific communities where the virus could spark up, and understanding the risks at play. National government doesn't have the nimbleness to do that, and it needs the humility and the self-awareness to understand that its tools are limited. It has a hammer, but not everything is a nail. At local government level, we can offer that movement. There's a flip side to this that I think is particularly dangerous in terms of local government in the UK and perhaps around the world too. That at the moment, our local government finances are being decimated by COVID, and national government is not making up the difference. Unless it does, we could see by default the biggest centralisation of power in this country in decades. As is being suggested, a number of local governments effectively go bankrupt as a result of COVID. And that was something that will further undermine the ability of this country to respond to the crisis and the consequences of the health crisis.